Today we will discuss something about glaucoma, where I would like to tell you about what is glaucoma and what are the common symptoms, or what the patient feels when he has glaucoma and how to treat it. Glaucoma is a common disease that affects many in India. The prevalence is supposed to be 2.63%, which is very high. That is approximately 12 million people in India are affected with glaucoma. That is a very large population. The problem with glaucoma is it is highly undetected, and unless somebody goes to the doctor and checks his eyes, the person will not come to know whether he has glaucoma, because it is asymptomatic. Means a person will not know by himself that he has developed such disease. Now, what is glaucoma? So glaucoma is a disease of a nerve of the eye, the nerve that connects your eyeball to your brain. This nerve is made up of millions of fine fibers called nerve fiber layer. When your pressure in the eye increases beyond a normal limit is supposed to be 13 to 21 millimeters of mercury. When your pressure rises above the permissible limit, this pressure directly affects your cells in the retina called ganglion cells, and they start dying with a process called apoptosis. The dying of these cells lead to the very slow and gradual loss of your nerve till it reaches a complete end where the whole nerve or all the fibers are lost. This process, if detected early, can be slowed down or can be stopped to a large extent if a person visits his ophthalmologist at the right time and he takes the regular and correct treatment. Most of the people are able to retain their vision throughout their life. Now there are different types of glaucomas. First, the most common is primary open angle glaucoma, where the area, now angle is the area through which fluid flows out of the eye. It is formed at a structure called ciliary body. It flows inside the eye and flows out of the front part of the eye called angle. If this angle is found to be open, it is called primary open angle glaucoma, and if this angle is closed, then we call it angle closure glaucoma. In India, especially in the Indian subcontinent, both these varieties exist to the same extent, the primary open angle glaucoma and angle closure glaucoma. And these are the most commonly found eye types of glaucoma. Primary open angle glaucoma and angle closure glaucoma are the most common types of glaucomas. In Indian subcontinent, they exist to the same extent. That is, the number of patients with open angle glaucoma and angle closure glaucoma are found with the same numbers. There are many other types of glaucomas also. Now, glaucoma can be caused due to multiple reasons. The most common reason is genetic predisposition. Now, primary open angle glaucoma and angle closure glaucoma both are genetic disorders where it runs in families. Say if somebody, if your first blood relative is a glaucoma patient, then your risk of developing glaucoma is 5 times more than the general population. So if somebody in your family has glaucoma, please make sure you visit your ophthalmologist regularly, at least once a year, because your chances of getting this disease are very high and you may not know that you have developed this problem. Then there are many other reasons also, like somebody is using steroids inadvertently. Say if you go to a shop and just buy drops on your own, or if your doctor has told you to use drops for a month and you keep on using it for years without informing your doctor, even steroids can cause raised eye pressure and ultimately glaucoma. So those who are using steroid drops or taking oral steroid medication, you have to be careful about this, and you have to inform your eye surgeon that you are on steroids so that he can specifically monitor you for this glaucoma related issue. Other cause could be just an injury to the eye. Any trauma to the eye can cause glaucoma. Glaucoma can be found in all age groups. It can be found in newborns as well as elderly. Although it is primarily a disease of elderly, even newborn children can have glaucoma. So all age groups are predisposed to this disease. Now there are other types of glaucomas also, something like pseudo-exfoliation glaucomas, and there are so many types. So only if you go to an ophthalmologist, you will come to know whether you have a problem. I would like to make a point about glaucomas in newborn. In our society, a newborn child with large eyes is considered to be a sign of a beauty, but sometimes it is not. A raised eye pressure can cause large corneas, like a bull's eye. It is called bull's eye cornea, where the cornea appears very large and hazy, and the child could have actually glaucoma. Even there is something called juvenile glaucoma, where this disease starts very early in the life, and only your pediatric ophthalmologist can detect that at an early age and treat it. I would like to make a special mention about glaucomas in newborn. If a newborn child is born with a very large looking cornea, it is important that relatives take child to a pediatric ophthalmologist for checkup, because this can be potentially vision threatening if undetected. A timely treatment in newborn glaucomas can save child's eye. Early diagnosis and treatment of this glaucoma in newborn can save child's eye. Now, treatment of glaucoma. Here I would like to make one point very clear, that earlier you start treating your glaucoma, the more you can save. So it is very important to go to your doctor regularly, get your glaucoma detected early and start treatment earliest, and follow it very regularly. It is a chronic problem and requires a continuous treatment and continuous observation with your ophthalmologist. The most basic or always the initial treatment for this problem is drops. Now we have great eye drops which can control your eye pressure to a great extent, and most of the people we are able to stabilize and save their nerve with drops only. So if you are diagnosed with glaucoma, don't get scared. There is a taboo in society that there is no treatment for glaucoma, which is absolutely not true. With modern medicines and modern surgeries, we are able to save most of the eyes. So let me tell you that if you go to a doctor on time, if you go to your doctor early, then you are going to save your eye. Glaucoma is a slowly progressive disease, and it is very important that it is detected very, very early. At the same time, it is very important to document that what is the damage that person has at this point. Since it increases every year, we can check and recheck to see whether damage is stable or it is increasing. Now there are different ways to document or know how much damage a person has. The most common technology we use is called perimetry. When I am looking at an object, I see that object clearly, but at the same time I am able to aware objects around me, surrounding me in the periphery. That is called my peripheral vision. And in glaucoma, slowly your peripheral vision is reducing. So to document your peripheral vision, we use a technology called perimetry. Your glaucoma is a disease of fine nerve fibers of your optic nerve, and with a technology called OCT, we can detect damage to these nerve fibers at a very, very, very early stage, called nerve fiber layer loss. Also, we can detect loss of cells called ganglion cells at a very early stage with a technology called ganglion cell analysis. We have also introduced a new technology called electroretinogram. Now it is a known fact scientifically that your cells are lost much before glaucoma becomes evident to an ophthalmologist. So if we can detect glaucoma at a cellular level with this technology, we can start treatment at a very early stage and prevent that person from going blind. If you are diagnosed with glaucoma, don't get scared. We have a lot of good treatments to treat glaucoma and control your eye pressure. The mainstay of treatment today is modern medicine are eye drops. We have great eye drops to control your eye pressure, and in most of the patients, eye drops are enough to control your eye pressure and stabilize your disease. However, in few, we may have to take help of lasers. In angle closure glaucoma patients, laser is a mainstay of treatment, where a simple laser can really prevent progression of glaucoma. This laser called YAG peripheral iridotomy is just done in OPD, takes only few minutes and it is almost painless. And this simple treatment can prevent glaucoma in this small subset of glaucoma patients, if detected early, of course. There are other types of lasers like selective laser trabeculoplasty. Now, selective laser trabeculoplasty is again a painless OPD based procedure which when done can reduce your eye pressure and control it to a large extent, where a person rarely has to use drops or has to undergo any surgery for glaucoma. There is again a new type of lasers called subcyclodiode, where a laser is delivered in a pulsed manner to an area of eye called ciliary body. Now ciliary body produces fluid in your eye, and if with a laser, if the ciliary body is slowed down, the amount of fluid formed in your eye will be less, and which leads to reduction in eye pressure. Now this is also a non-surgical procedure which takes only few minutes to do and is able to control glaucomas in large number of patients. Now there are patients who are not controlled with eye drops or in whom eye pressure is not controlled with lasers also. So only in that small percentage of patients we ever have to do glaucoma surgery. Now there are different types of glaucoma surgeries. The most commonly performed is trabeculectomy. Now trabeculectomy is a very gold standard surgery which is existing for almost 5 decades now, but it has got more and more improved over the years and it has got better and better in controlling your eye pressure. What is trabeculectomy is it creates a small window in your eyeball and which allows your fluid inside the eye to seep outside. However, this small window is guarded to prevent any problem to the eye or any infection to the eye. This is called trabeculectomy, which typically takes 15 to 20 minutes to perform. There is no hospital stay, patient can be sent home immediately, and it is a safe and effective surgical procedure to control your eye pressure. Now there are some complicated types of glaucomas, or there are certain patients in whom trabeculectomy is not working anymore after few years of it being done. Now in those subset of patients we do another good surgery called Ahmed glaucoma valve. Now what is Ahmed glaucoma valve? It is a silicone tube basically. The one end of tube is inside the eye and other tube is outside the eye, and it's draining fluid from inside to the outside in a very guarded fashion. And this is a very effective way to control your eye pressure. In complicated glaucomas where previous surgeries have not worked, we prefer to do glaucoma valve, and it works in large number of patients and it's able to control pressure to a great extent.